So here we are with Russ Scala, talking about high-functioning individuals, some of his high-functioning clients. Give us a couple of examples that you see in the news media that is shifting this paradigm of medicine.
Yeah, these are really exciting times, Trent. Just recently, as you see, the two New York Times articles that we're talking about just a couple of weeks ago, we're now able to look at the intestinal tract, the flora in the intestinal tract, and see if that flora is in balance. The intestinal flora affects our brain chemistry, and now the intestinal tract is being looked at by neurologists as a second brain. So what goes on in the intestinal tract affects the brain chemistry.
So how so? Like absorption of food and nutrients?
Yeah, we always tell people that you are not what you eat, you are what you absorb. And you got about 400 different flora in your gut that works to protect us, to elevate our immune system, to speed our metabolism. And even if that gut flora is out of balance, not only will it affect your brain, but it also will put weight on you. So a lot of the obesity epidemic now is tied directly to the intestinal tract. So that's exciting.
That is interesting, yeah. And you can look at that and evaluate that, and you can see the foods that you're eating and what's not benefiting you as opposed to what is benefiting you?
Right. We've been testing the intestinal tract for 10 years, and this article just came out last week, 2015. So
they're catching up.
It's good. We've always focused on the intestinal tract with a lot of my high-functioning clients. Another area that's a very hot topic in the New York Times, you can see the psychiatrist next to the MRI. Now, for hundreds of years, psychiatry just did talk therapy, and it's one of the only medical professions that doesn't really look inside the brain. Well, now they're tying the FMRIs. We can look at the brain in real time. It's kind of changing the paradigm in talk therapy. So if the paradigm's going to change in talk therapy and we can look inside the brain in real time, then we're going to be able to speed treatments for people faster than we ever have before, instead of just giving them an antidepressant or some kind of psychotropic drug. We're just guessing. Now we look inside the brain in real time. That's why these two articles are kicking ass.
Wow, so you can kind of see when their neurons and stuff is firing based on what you're talking to them, emotional responses and all that
Exactly.
stuff.
We could look at the brain in real time, look at the functionality of the brain, and then with our testing, with our urine sample, we look at neurotransmitters, serotonin, dopamine, and adrenaline. Now you take what we do, and then you go to, you look at what these psychiatrists have done for years, just sitting there talking to the patient for months and even years. Now we're able to look inside the brain, look inside the metabolism. There's other parts of the body that affect the brain chemistry, your adrenal glands, your thyroid. A lot of people that don't respond to antidepressants have low thyroid function, but nobody talks about that. So physiologically, we look at multiple metabolic markers, and then we look inside the brain in real time with the fMRI. Now we just fast forward the people to wellness, get them feeling better instead of just medicating them with a drug.
Who doesn't want to do that? Like, treat the body as a whole, right?
Exactly.
Goodness. All right, so getting into some of your high-functioning clients, some of these individuals, what makes somebody a high-functioning individual?
Well, I started high-functioning individual. Let's look at some of the Ironman triathletes or the endurance athletes. I've been testing these folks since 1984. I raced myself for like 20 years. When you take your body to those limits and to those extremes, and you keep covering large distances, I don't care whether you're climbing K2 or you're trying to finish an Ironman, multiple parts of the body shut down. And what the dirty little secret is, a lot of these athletes, and I was one of them, I was confusing fast race times with health. But in reality, when I would finish a half Ironman race or I would finish a racing season, I was depressed, all my blood levels were low. I mean, this is embarrassing. I couldn't get an erection for months after a race because my testosterone levels were low. So, you know, these things were happening to me, and I couldn't go to a doctor because I'd go to a doctor like a lot of my friends, and they would see a tan guy with a low resting heart rate thinking they're in good shape. We had a lot of things going on that was causing damage. So these extreme athletes that we have tested, these high-functioning athletes, when they run into a wall, they really don't have anywhere to go, and this is why they come to us now. Gotcha. Everything from heart arrhythmias to depression hits these athletes hard, and nobody discusses this, but I know I lived it, and I take care of the athletes now that are going through it.
Okay, so then tell us, what type of high-functioning clients do you deal with?
Well, let me give you an example. I had a hedge fund guy that was in charge of a multi-million-dollar company, and he got so fatigued and so tired, he basically couldn't get off the couch. So I ran some of our testing on him, and you know the story. He'd been through his doctor, he went through his general practitioner, he went to an allergist, he went and talked to the guy with the dreadlocks and the TVs at Whole Foods, still no help, right? So as I started drilling down on his testing, I found out that he had low neurotransmitters, his adrenals were shot, his thyroid functioning was way off. So For this guy, I looked at multiple metabolic systems of his body, and we just started to rehab that with a treatment protocol to help him get better. So what took him 2 years, I kind of pulled together in 30 days.
Wow.
Yeah.
And this is a CEO, so it's not an athlete, so he's not physically fit or active, but he just has extra stress in his life, perhaps.
Exactly, and he's a mental athlete. And let me say, the Ironman endurance athletes, the guy that climbed K2, they're very physical, but they're also guys out there that use a lot of mental processing power because your brain does not shut off. And a lot of these guys, believe it or not, they can't sleep at night because they're running scenarios about the workday. And those scenarios just keep running. And when we're young, we have these little Pac-Men in our brain that eat up excess adrenaline. Well, when we get older, those Pac-Men disappear. So anything that upsets you or gets you thinking really hard after 3 o'clock, your brain keeps cycling and they can't sleep. And that's why we have to focus on the brain and the gut at the same time. We have to calm these people down without drugs or alcohol or the ladies, but that's that's one of the things that everybody gravitates to when their brain's out of balance.
Slowly get them off one at a time.
Right, exactly.
So tell us, what makes treating these individuals a little different than just your average person or what your average doctor does?
Well, when I dive into somebody, I do a deep dive into their physiology, and let me give you an example. I may have a guy that's socializing 4 nights a week that has to meet and he has to drink, and I evaluate that. Now, obviously alcohol elevates estrogen levels, so I get him some things that'll help block his estrogen so the alcohol doesn't cause a big hit to his body. I try to build these programs around their lifestyle because I know they're not going to stop drinking and they're not going to quit eating carbohydrates if they're addicted to the carbs. It's a process. So I plug these things into their program, and then we slowly work on their brain chemistry, slowly work on their performance to help them stay in the game. I mean, we are not the food Nazis. We don't just push supplements. We really take a deep dive into a highly functioning person's physiology, and we build a program. Okay, these guys are going to go to a doctor. The doctor's going to say, you need to quit smoking cigars, which my clients aren't going to do. You need to quit drinking, which my clients aren't going to do. Now, I switch them from beer, the liquid bread, over to hard alcohol because it doesn't elevate insulin levels. That's a hoo-yah.
Okay.
All
That's
right?
a win for you, huh?
Yeah, that's a win. That's a win-win. Keep them drinking, but keep protecting their liver.
Cool. Give us a specific example of a due diligence you did when you went into somebody's house or their work or their environment.
A very interesting due diligence was we had the Bethune-Cookman College president, which is on our YouTube channel, Trudy Reed. We did advanced testing on Trudy. She had bizarre symptoms that no doctor could answer. She was losing her hair. She was getting fatigued. She was having a hard time staying awake at work. And when we started doing testing on her, we found some DNA damage. And then part of the testing, we recommend that they test the building. And when they drilled inside the walls, they found Aspergillus black mold. They evacuated everybody from the offices. And Trudy was one of the people in the office. There was 5 of them, I think, out of 20, that black mold was compromising her metabolism, making her feel bad. So what we bring to the table is a lot of physicians, and I'm not shooting down physicians, I'm just saying they don't understand how the environment can impact your hormonal levels or your nutrition or your physiology. The environment can affect us in many ways, but nobody looks at that. And we did look at that with Trudy Reed and turned her around.
Wow, that's amazing. Because most people would think I'm just getting older.
Right, exactly.
Maybe I need to eat better, a little more exercise.
Right.
Why do I have these headaches? But boom, the
Yeah,
environment.
and that's why we have to take a deep dive. We offer testing that traditional medicine doesn't offer.
Not to shoot down doctors or physicians, but just the medical model and the practice. What are you doing that's different or better than them, or what are they doing wrong? Tell us about that.
Well, physicians, I have some of my best friends are physicians, and I have physicians on the program, so I don't shoot them down, but I understand their training.
Because they're all good people. They want to help.
Every physician I've ever met wants to help. His toolbox is just limited. And physicians are used to taking care of, they're used to taking care of sick people. Mm-hmm. When they have a CEO come in that's having problems with his brain chemistry, or a triathlete that has been racing for 30 hours a week, or a college president that her hair is just falling out, that takes them 2 years. And in that 2 years, they have to go to multiple doctors and psychiatrists, and everybody's giving them different medications and trying things and throwing a dart at a dartboard. And that's the way the system is right now. When people hire us, I have to dive in. I meet them face to face. I do a discovery. We have to do a deep dive in their metabolism, get them out of the railroad tracks. Some of my clients, if they don't run their company, they're losing some millions of dollars. So they hold me to a high standard. Let's make something happen, stud, and I have to make it happen along with my team. So we take a deeper dive, and And the way the medical system is, they compartmentalize everything. And by compartmentalizing nutrition and hormones and the intestinal tract or exercise or acupuncture, or the guy with dreadlocks wearing the TVs at Whole Foods, they all got great information. We just have to package it together and see what's going to get that person answers quickly.
Because I understand you have a pharmacy, a doctor, all in one roof. You can do the dosing, you can adjust dosing, stuff like that.
Yeah, example is we have in our facility, we have a pharmacy, a training center, and we have a physician that we're able to adjust dosing very quickly. Like one of our clients last week, we adjusted the dosing 4 times in 7 days. Now, for a normal person, they would have to go to a doctor, wait a week, go to another doctor, and wait another week.
Yeah.
They wouldn't talk to each other. And this person, you see, everybody's biochemically unique, and they need different dosing. So 4 milligrams may work for you, 100 milligrams may work for the next person, but here, this person has to get it within days, and that's sort of what we bring to the table. We make sure that happens quickly. It's not just me. I have a pharmacist. I have a research lab. I have physicians that are trained specifically for this program. So collectively, we get people answers quickly.
Yeah, that's good. Who likes to wait and talk to their doctor?
I'm just
get
saying.
An appointment weeks out, yeah. So with all these high-functioning clients and individuals you deal with, what is the one thing that has surprised you over the years?
I think what really surprises me is, like, you know, I've been inside of beachfront mansions from Boca Raton to Beverly Hills. I've got a celebrity agent that sends me clients, and even the people that are very, very wealthy, you know, they're not getting answers. And I always thought that they had the best doctors, the best of everything. But in reality, you know, they're not getting answers either. And that's, I mean, we need to fix our medical system.
Especially if they have the means to pay for it and they're still not getting answers.
Exactly.
And that just shows you something's wrong with the system.
Exactly.
So it's good to see that you've got a system that works. And you've
Yeah.
got folks to do it.
30 years in the making. Nice. So, you know, I'm an overnight success in 30 years.
That's Russ, folks, the Institute of Nutritional Medicine and Cardiovascular Research.
Thanks
for
Brent.
stopping in.
All right.